There's been a shift in the temporary aid to needy families, or TANF funds, from cash assistance to other programs to help people in poverty. Because it's not indexed to inflation and is a fixed block grant, Dolan has said Republican Senate leadership is concerned that programs will cost more than TANF will cover.
We get TANF money in a block grant, and if you don't spend the entire block grant, it goes into the surplus fund. And we have built up a surplus fund, which a few years ago we started then providing to additional programs out of the surplus. Surplus is going to go away, and so the TANF block grants that we receive are to pay for child care and food assistance. Well, the child care program, as we're discussing it back and forth, the price tag for that is increasing every year. And who knows where we're going to end up in this budget, where it's going to be. Majority of that comes from the TANF block grants. So if we're going to make an obligation to child care through the state, we better make it in the confines of money that we know we can spend. And if the TANF monies keep going out to other programs, it won't be enough for child care.
Britton with the Center for Community Solutions is concerned about TANF spending long-term as well.
We have increasingly used TANF in this state to fund health and human services, which, it is focused on helping people living in poverty, but we have, at the expense of, I think, focusing in on those work training programs and really making the cash assistance program worthwhile, that can train people for future careers. We've kind of shifted how we're using those dollars, and they're really focused on, childcare is the largest source of TANF funding now in the state. Other very worthy causes, including childcare, we're using mostly, TANF for, and TANF is a block grant, so we get the same amount every year from the federal government, and that is eventually not going to be enough to fund these programs. So, I think the advocates in the health and human services space have been talking about and been in conversations with the state about, let's really understand TANF, let's figure out sustainable, dedicated funding for childcare and these other causes that we've increasingly just used TANF for, and ultimately it's not going to be sustainable.
There was a change in the first Senate budget to the Supplemental Nutrition Assistance Program, or SNAP, commonly known as food stamps, that would have required people 16 to 59 to either be in work or training programs. That's a change from where it is now, 18 to 49. That was scrapped, but there is a new addition in the final Senate budget that requires photo ID. What's the problem with that?
Yeah, so they changed the provision to include SNAP photo ID requirement, which would mean that, SNAP food stamps are on an electronic benefit card. That would require a photo ID and a phone number of one adult in the household. And there's a couple of exceptions if there's an older adult, if ever all the adults are 60 or older, if there's a disabled member of the family. But by and large, if there's an adult in the family, it would require a photo ID. The problem with that is we've seen this attempted in other states. It's really expensive and burdensome to implement, and is really a challenge to the functioning of the program, because the federal guidance or the federal laws around SNAP say that everyone in the household has to have access to use that card. And so if one person's photo is on it and someone else in the family is trying to use it, that creates a challenge in the actual physical use of the card at the grocery store. The cashiers are not allowed to cross-check IDs. So that's really a problem in the federal regs that say everyone in the household has to be able to use the card. Federal guidance also says that you can request help or assistance in shopping for food, and so that obviously also creates a problem if someone's picture's on the card and the person using it is different. SNAP also has a lot of anti-fraud measures in place already. And so we know that, folks have to recertify their eligibility on a routine basis. The counties in checking eligibility check lots of systems to see income, identity. They have lots of ways to check that. And so we really have a lot of anti-fraud measures in place in SNAP and haven't seen this as an enormous problem. So that's really the issue with the photo IDs.
When it comes to food, the budget does make some changes to food banks, which are reporting record demand right now. Is there a concern there?
Yeah, so we know that the food bank's request in the budget was they made some progress in the House version of the budget in terms of getting additional dollars into the food banks, and that was not as high in the Senate version of the budget. So we are concerned that they're seeing record demand, especially as some of the pandemic assistance has phased out over the last few months, that we're making these changes to SNAP at the same time that food banks are seeing record demand and not enough support. So it is a concern.
There was a lot of talk among Republicans, Governor Mike DeWine and others, about the budget being family friendly and focused on women, focused on children, focused on families. This budget does make some changes, though, to Medicaid, specifically in those populations for pregnant women and for young children.
Yes, so I believe the governor's quote was, "We want to make Ohio the best place to raise a family." And the governor and the House, I think, kind of held true to that. Really, the introduced budget from the governor said that we're going to increase Medicaid eligibility for kids and pregnant women up to 300% of the federal poverty level. The House added a provision that would provide continuous Medicaid coverage for kids to their 4th birthday. So that continuous coverage is sort of a wonky term, but basically means that kids, once they're enrolled up to their 4th birthday, wouldn't have to do a recertification process. So really, that's obviously a burden on the parents to keep their kids engaged in Medicaid coverage. So we think that those policies are a really good way to go. The increasing coverage for pregnant women, especially after the state 2 years ago expanded coverage for pregnant women from 60 days postpartum to 1 year. We think this really builds on that, making sure that to address our ever increasing maternal mortality and morbidity rates, that this would go a long way in helping women in that time period. And then for kids, we know that when parents lose coverage, kids often lose coverage even if they shouldn't have, because we cover kids to a higher income range. And so keeping kids engaged in coverage up to their 4th birthday really would go a long way in keeping kids enrolled in Medicaid.
And this budget changes that, pulls that back.
Yes, so the Senate has removed those policies. Basically, I think some of the conversations that we've had is around looking at the Medicaid program in totality, and the view of some folks in the Senate is that we don't want to add expansions of Medicaid into the program